Welcome to Resolve IBS and IBD Naturally. I'm Courtney Cowie, a nutrition therapy and functional diagnostic nutrition practitioner. If you are struggling with the symptoms of IBS or IBD and want to get to the root cause of your symptoms so you can take back your health through a whole person approach, this podcast is for you. Just a disclaimer that the information I'm presenting in this podcast is for educational purposes only and should not be taken as medical advice. You should always consult a qualified practitioner before making any changes to your health or medical regimen. That being said, let's get on with the show. All right, Dr. David Bilstrom, welcome to the podcast. I'm super excited to have you on today because we're going to be talking about the role of epigenetics and autoimmune disease and chronic illness. So welcome. And why don't you start by just giving us a little bit of your background?
Well, Dr. David Bilstrom, and my original area especially was as a rehabilitation doc. I subspecialized in spinal cord injury. And so everybody that I saw as a patient was either paralyzed from the neck down, the waist down, very complex population, very sensitive medication side effects. There weren't a whole lot of medications available to help them with every organ system that was adversely affected all at the same time because of the trauma. And so after a while of being frustrated, kind of running out of options for so many things, I said, geez, wouldn't it be great to have, another option out there that didn't have any side effects and might be able to help with everything. And as I delved deeper into that, I found acupuncture. And it's good for so many things. There's no side effects. The worst thing that ever happens is nothing happens. Unfortunately, usually something good happens. It's been around 5,000 years. But so I trained out of UCLA and became board certified in medical acupuncture. And oh my gosh, it worked so much better than I ever thought it was going to work. Instantly, I started doing a ton of it. I had 11 different partners at the time that were doing all kinds of rehabilitation for the people with really chronic, complex issues. But it really got me thinking, what else is out there that I never learned about in my traditional medical doctor training.
Yeah.
And it set me down like a 30-year path to find out all the things that I wasn't taught. Just in all the scientific journals. It's just not the ones that people tend to read. And with the explosion in medical knowledge the last 20, 30 years, nobody can read everything. It just doesn't tend to be any of this conversation that you hear in more traditional medicine. And the last 10, 15 years, I've specialized in my goal, and hopefully I'm doing a good job to start with, is changing the way that autoimmune disease is dealt with worldwide, preventing, reversing all autoimmune disease rather than just throwing some bandage medicines at it and then letting people get worse and worse and worse over time.
Yeah, so that's amazing. How did you transition from kind of working more with like spinal injuries and paralysis to the autoimmune world?
Well, of course, I've always been really interested in chronic disease, and I
Yeah.
kind of really interested in trying to know the things that most people don't know.
Yeah.
And uh, with the acupuncture, I started treating kind of everything. And
Yeah.
then, the more and more chronic individuals, and including so many people that I would see that had autoimmune disease where their bodies were basically attacking themselves.
Mhm.
And if you're attacking your own body parts, you're basically self-destructing. And that is always going to be counterproductive. Never a good idea to attack your own body parts. And but I trained then in integrative medicine and functional medicine. And so I'm actually board certified 4 different specialties. And reversing these chronic health issues that people, the classic picture is they've been to 5 to 7 doctors, 3 to 5 years, can't get even a diagnosis, so they're getting worse and worse and worse, and they finally get the diagnosis and they go, good, okay, now what can we do this? And the only thing they're ever offered is bandage medicine, and they keep getting
Right.
worse and worse despite that. And
Yeah.
then I read a really heart-wrenching story. It's just so sad, about this famous journalist. I read about it in the New York Times, this famous journalist who was losing her profession and her life to lupus, one of the autoimmune diseases.
Oh,
And the
sure.
story that she wrote about was one I'd heard more than 100 times already. And I said, this is so sad. Okay, somebody's got to change the way autoimmune disease is dealt with, and maybe I'm the one. And so that's what I've been doing. And so far so good with getting the word out. And epigenetics is something we talk a lot about. not something most people talk about, including most doctors don't talk about. And I'm so excited to talk about that with you and your listeners.
Yeah, absolutely. So let's kind of start right there because epigenetics might be a term that the listening audience isn't familiar with. And you can kind of speak to this question as well, David, but I wonder if in conventional medicine, there's a little bit more of a genetic determinism philosophy versus an epigenetic philosophy. I don't know if you have kind of like thoughts on that, but maybe kind of explain what the difference is between those two.
Yeah, you're absolutely right. Is you hear a lot about genes in our DNA nowadays, but you do not hear about epigenetics. So we used to think, and unfortunately, most people still think this way, is our genes, our DNA is made up of genes, and the genes tell the cells what to do. Well, historically and mostly currently, everybody says, well, it depends on what genes you have.
Mhm.
And you're thinking, geez, I see what's going on with my parents and grandparents, and I hope that I got their good genes and not their bad genes. And so everybody's all about DNA. But what we now know is it's not what genes you have, it's which ones get turned on and turned off. And that's
Mhm.
epigenetics. So epigenetics are the things that can change gene expression without changing the genetic code itself. And so, people, when they decided to do the Human Genome Project, 12 years, like a dozen different big institution, tens of billions of dollars, they said, okay, if we can sequence the human genome, we'll find every gene that causes every disease. We'll go in and zap that gene, and we'll turn around that chronic health issue. Well, after they got done with all this, basically it was like, oh, well, actually, it's not what genes you have; it's which ones get turned on and turned off. Now there's a
Right.
uber rare 50 people in the world where they go, oh, that is a bad gene, and we'll go zap it, and it really helps. But that's the exception to the rule, which is we got a lot of bad genes, we got a lot of good genes in every cell in our body. If you're not feeling well, you're starting to get these health issues. Well, it's because you're turning on the bad genes and turning off the good genes. It's happening in every cell in the body. And this is why it's so easy to get one thing and then another thing and then another and another, because every cell is being told the wrong information. And over time, you just get everything is being told the wrong information all at the same time.
Yeah, 100%. And I think it's so fascinating when you look at families and you see maybe one or two more vulnerable individuals, and you know that theoretically the gene pool is kind of shared amongst the whole group of people in the family. So I think that's kind of a common example of how each of those individual constituent factors can kind of help inform which of those genes express. And then this is another interesting one that sometimes I come across too, where, I'll have prospective clients talk to me about, like, Crohn's runs in my family or colitis runs in my family. And the interesting thing about that is they might have that genetic potential, but you've probably seen this in your work as well, David. Like, often what's actually activating those genes are shared family cultural patterns, I would think, right? And environmental things that are actually causing this state. And so people then are mistakenly thinking that they're just basically inheriting these illnesses and they're just expressing, and there's nothing they can do about them, right?
Basically everything runs in families, right?
Yeah,
Because of
yeah,
what we're talking about. But
yeah,
it's sort of like, well, this runs in my family, and the best I can do is cross my fingers and hope I don't get it,
yeah,
kind of a thing.
yeah,
And it's like, oh, no, 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 because we know what turns off good genes and turns on good genes. We also fortunately know what turns off the bad ones and turns on the good ones, which is
yeah.
really nice, because if you're doing something that works through epigenetics, you're basically able to, turn genes the right way in every cell in the body at the same time. And you're able to fix anything, including everything that an individual may have, because it's all super connected.
Yeah, 100%. So before we get into talking about things that can help signal the good genes, why don't we talk about what are some things you see commonly signal the bad genes?
Yeah, so just inherently, we have a lot of bad genes. And so like 8 to 10% of the human genome is actually viral. And so viruses have gotten into humans since we started as humans, and try to insert their genetic material into our genetic material, so that our genetic material starts producing copies of themselves, or viral proteins and all this kind of stuff. And so the vast majority of those are really, really old, and our bodies basically just shut them down. but there's still a certain percentage of viral genes that we have to actively every day shut down, because we don't need, if a virus gets into us like the flu,
Yeah.
it makes us feel sick as a dog, right? Well, we don't need that stuff being produced day in, day out by us to make us feel
Right.
like a dog. So we got to shut that down. And so, um, there's a lot of things that will start flipping genes the wrong way. So like trauma. So you think things like adverse childhood events, and
Mhm.
things like, in your family as a child, there's divorce, separation, substance abuse, incarceration, somebody gets thrown in jail, verbal, sexual abuse, physical abuse, trauma, all these different traumas. Well, we now know that they flip genes the wrong way. And that's what drives not only chronic health issues in children, but also by doing that early, it drives it, chronic disease your whole life. And then
Yeah.
it's passed down from generation to generation too. So we used to think that, if you don't flip genes the right way before conceiving a child, well, that you passed on crummier gene expression to the next generation. But actually, we now know it's 6 to 8 generations.
Oh,
Something
wow.
happens 6 to 8 generations before us, trauma, other kind of things that have flipped genes the wrong way. If they don't flip them the right way, they keep passing it on from generation to generation. And so,
Wow.
like, I was usually lecturing a couple of years ago, like 4 to 6 generations. Then my daughter, who was an undergrad at University of Wisconsin, said, "Dad, I had this science class, and they said this epigenetics now has been shown to be 8 generations." And I'm like, "Oh, I love you, sweetie. You're a wonderful human being, sharp as a tack. Thank you for telling me that, because it's like, oh my gosh, this is part of this generational trauma stuff that you hear about.
Yeah.
Truly trauma, its impact on our epigenetics really is passed down from generation to generation. Um, in the medical literature, you kind of hear, well, you really like to optimize epigenetics, ideally by age 18,
Okay.
18, because if you can do that, you set the system in a really good place and you're healthier your entire life because of that. And then the last decade or so, when you hear about these adverse childhood events and their profoundly negative impact on stuff, they go, hey, you got to flip the genes the right way by age 19 if you're going to keep somebody from having all these chronic health issues. And I'm like, oh, that's so cool that kind of trauma, the adverse childhood events, dovetails what we already knew about epigenetics. And 18, 19, you really want to set it. Now, if you can set it the right way on anybody, 30-year-old, 50, 80, 90-year-old for that individual. Ideally, if you can set it before 18, 19, you're healthy your whole life. You can set it before conception, before somebody conceives a child. Well, now you passed on cleaner genes to the next 6 to 8 generations. And you're really doing a great service for future generations in your family by getting these genes flipped the right way.
Yeah, I love that we're having this conversation because just serendipitously, I was literally yesterday having another conversation with another podcast guest on the work of Dr. Joe Dispenza. I don't know if you're familiar with his work, but he kind of gets into this whole quantum field visualization, kind of activating basically the good genes through some of these deeper, brain neuroplasticity pathways that we can start to rewire over time, right? And it was just this, David, like we were literally having this version of a conversation and talking about the potential of any given individual, if they're motivated and dedicated enough to that process to heal trauma in their lifetime, it can instantaneously heal it forward and heal it backward, almost kind of like in time and space, because it gets very esoteric, but how that whole genetic lineage, if you will, like it's like that switch will flip. It can flip badly. It can flip back in the right direction too, which I just
Yeah.
find that so fascinating. Yeah.
And it kind of sounds like, man, this is so complex, this is so relevant, but it must be not so easy to do this. I mean, geez, if something this
Yeah.
complex and profound, it must be really hard. But I know we're going to get to the fact that, well, it's really not as hard. The body is so smart, and really it's designed to fix everything itself. It's, the body's always trying to move towards wellness,
Yeah.
and it's just this natural default mode. And so if it's not able to get there, there's got to be something in the way. And all we got to do is kind of get it out of the way. And the body goes, all right, I've been waiting for my opportunity here. Let's go. I can start fixing everything.
Yeah, that's the beauty of functional medicine is like there's this operational principle that the body has its own self-healing capacity and we just have to kind of like support that and get the stressors out and support the deficiencies and man, it just knows what to do. So, here's the question that's coming to mind because I know you're really passionate about looking at autoimmune potential as far back as childhood, right? So, let's say there is a child or maybe a parent is listening and they wonder if maybe this is a piece playing a role in one of their children. What are some things that you can start to identify or think about even at a young age? Because as you kind of suggested, it can sometimes take decades before these autoimmune markers become prevalent enough that there's an actual diagnosis now at play, or even before the symptoms really start to show up in a significant way, right?
Yeah, kind of in the big picture, we now know the immune system is such a part of all chronic disease that, and epigenetics is part of that, that if you have something health-wise that is not just right, you have
Mhm.
epigenetic issues, you have an immune system issue. As
Okay.
mild or as, well, that's not a big deal. It's already starting. And so for the immune system is a really great example of how the body likes balance. There's
Yeah.
always going to be a sweet spot in the middle of everything. You never want to be too high or too low in anything. So I
Yeah.
oftentimes in the clinic, I talk about, well, blood pressure or blood sugar. Well, you don't want to be too high, but you don't want to be too low either. There's always a sweet
Mm.
spot, right? But in the
Right.
immune system, and this is one of the things I find so fascinating about the immune system, when you lose that set point right in the middle of the immune system, you actually move away from it up and down at the same time.
Yeah.
And so the overactive immune system issues are all the autoimmune diseases, as well as asthma, eczema, and allergies. And then the
Mhm.
underactive immune system issues are colds and flus and infections of all kinds, getting the same infection over and over again. The
Mhm.
infections that drive chronic disease, which are very specific and easily testable in a blood test, a poop test, and then cancer. And so this is where they talk about cancer being the flip side of the same coin, this autoimmune disease. So everything that drives autoimmune drives cancer.
Yes.
And so at very young ages, you say, oh, my child got an ear infection, and then they got several ear infections, or strep throats, or sinus infections, or urinary tract infections, you go, you have already lost your set point. You have moved away, you're getting the down stuff. But also, if that child has asthma, allergies, or the skin issues, eczema, you've lost your immune system set point. You've
Mhm.
already moved away from that set point. So if you start getting those kind of things, you instantly know your child has lost it. It's very important to get it back to the middle. But one of the nice things, we know what does the disruption of the immune system, loss of the set point, we know what brings it back. So if you don't do something, you may say, well, it's just allergies. What's the big deal? We got Benadryl. Oh, well, here's asthma. We got an inhaler. You hear about kids dying on a sport field all the time with ideally well-controlled asthma. But
Mhm.
you're like, well, here's these, infections going on as well. And so it's finally important to identify that for what it is, which is a disrupted immune system. If you don't fix it, then you choose any kind of bandage medicine without fixing the disruption, bring it back to the middle. Well, you keep moving farther and farther away, get more and more things. Time marches on, you keep adding new things on top of the old things. And then here's cancer, including
Mhm.
childhood leukemias or cancers in children. Here's autoimmune disease. Here is the classic autoimmune diseases, but also we now know that this immune system disruption is really part of all disease. So we're talking about, it ties into all the kid stuff, whether it's all the brain stuff, autism spectrum disorder, developmental
Mhm.
delay, ADD, ADHD, depression, anxiety, bipolar schizophrenia, migraine, seizures, all this brainy stuff that kids are dealing with. Well, this is all tied into that. And then all the
Mhm.
brain stuff as an adult, but then you get into osteoporosis, heart attacks, strokes, Alzheimer's, dementia. It really is tied into all this, but you can see this stuff coming very early on in a child's life, especially with those infections using recurrent antibiotics or
Yeah.
antibiotics before the age of 1. Oh my gosh, how that whacks the system
Yeah.
in women, because 80% of people that get autoimmune disease are women. One thing
Mhm.
that's very common is a hormone imbalance called estrogen dominance, where you have
Mhm.
too much estrogen compared to progesterone. I call it the most dangerous disease for women because it drives everything crazy. It is the main cause of all the hormonal menstrual things. And
Mm-hmm.
it's almost like what woman doesn't have one or multiple of these, which is bad menstrual flows, bad menstrual cramps, you know,
Mm-hmm.
ovarian cysts, polycystic ovarian syndrome, fibroids, endometriosis, breast cysts, fibrocystic breast disease, and infertility. You know,
Mm-hmm.
it was relatively uncommon to get those things. Now it's like, oh my gosh, who doesn't have that? But
Right.
also because estrogen revs and progesterone calms, you get rev without calm stuff. So here's, geez, I'm more of a worrier than I probably should be. I think I'm a worrier. Geez, I'm kind of an anxious person. Geez, I don't sleep great. Geez, I get panic attacks. And it's like, that's all estrogen dominant. So you look at the rev without calm stuff, that is so common. The hormonal menstrual stuff, that is so common. But this is a huge disruptor of that immune system. And that's
Yeah.
why 80% of people that get autoimmune disease are women. With this estrogen dominance before menopause, it doesn't just double a woman's risk of breast cancer before menopause or triple it. It actually 5.4 times, over 5 times the risk of breast cancer before
Mm.
menopause when you have this estrogen dominance. And it's a 10 times greater risk of malignant cancers, the ones that start one place and metastasize someplace else your entire life. And so, you know, these are the kind of things that happen at young ages that you go, well, that's not good.
Yeah.
But it's very important for people to know what that is telling you so that you can fix it, because you don't need any of those hormonal menstrual things or the rev without calm things. They all stink. You can't just throw a bandage at them and go, oh, I did what I needed to do. It's like, no, no, you need to understand what this means. It is fixable for sure, but
Right.
you've done your due diligence to lock the system in a good place at young ages before you ever start getting, you know, all this other stuff in adulthood.
Oh, for sure. Yeah. Oh, the hormone bucket is just such a deep one. And, I think the biggest like fix that conventional medicine has for that is just to throw women the birth control pill, which just does even more damage. So,
Which
yeah,
worse, it's acid based, so it makes the
it
estrogen
is.
dominance worse.
It
And it
is. I
kills and it
know.
kills the gut and all this other
I
kind of stuff
know.
that goes on. Yeah.
Depletes the B vitamins, all of that, right? Yeah, it's crazy. But I'm so glad you're saying this because I know my own personal gut health story, like all the way back to childhood, I was having chronic stomach aches all the time, right? And very, I guess, what's the word I'm looking for? I could deal with them by putting pressure on my belly, right? Like that was just kind of my childhood intuition. But, just growing up back in the 80s, like no big deal. I was pretty healthy and active. And I think as my parents sort of saw the situation, nothing serious was going on there. And I think this is why these conversations are so powerful because we're at a place now where people are more health forward, right? Like they want to be more preventative and more proactive. And, I know as a parent now with children, I pay attention to things at a level that my parents just didn't know how to do back then, right? And, not to say it was any one thing, David, but I know that those early signs were there for me way, way back then. And then as I grew into an adult, the gut breakdown just got worse and worse and worse. And then eventually it became my passion to get into it and try to figure and sort out the pieces of the puzzle too, because I wasn't getting those answers from conventional medicine. So you're 100% right, which is the whole like starting early, looking for those signs.
You know, you were in some ways fortunate that you had the gut symptom that told you there was gut stuff. Now, unfortunately, the level of knowledge back then wasn't what it was today, but the
Yeah.
gut is such a central mechanism. If you
Yeah.
have any kind of gut stuff, you go, well, my gut's off. Well, it's not going to be a good thing because we realize how important the gut is. But you can
Yeah.
have absolutely no gut symptoms, but the gut problem is showing
Mhm.
up as everything else outside the gut.
Yes.
The gut's totally
Yes.
whacked, no symptoms. And this is one reason why 80% of people with celiac disease never get diagnosed. And celiac
Mhm.
disease is where the immune system is attacking the small intestine,
Mhm.
self-destruct. Wheat proteins like gluten and gliadin become like battery acid. You might as well be chugging battery acid as eating some wheat, right? And but doesn't show up as gut stuff. And
Yeah.
so, but it's shown up as everything else. And so
Yeah.
nobody ever thinks to check the gut whenever all this other stuff's going on. And there's kind of like two major, and kind of the traditional terminology on celiac, there's classic celiac and atypical. So
Mm.
classic celiac, you got tons of gut stuff and everything else is all whacked too.
Mhm.
Atypical, you got no gut stuff, but everything else is whacked. The thing is though, atypical is 80% of celiac. You got no gut symptoms, but everything else is whacked. Classic celiac I feel terrible gut stuff and other stuff, that's only 20%. So you actually
Yeah.
switch the terms. The classic celiac should be, I got no gut stuff at all, but everything else is whacked. The classic is, oh, you got terrible gut stuff and everything's whacked. Oh, you got this atypical celiac disease kind of a thing. The words
Mhm.
are totally reversed,
Yeah.
but have terrible gut stuff, just an absolute mess. But it's not showing up as gut stuff. It shows up as everything else.
Yeah, no, that's so true. And I've heard the exact same thing that actually it's more likely to express like brain wise, if anything, right? Like oftentimes it's like mental health disorders, sometimes very severe
And
things like
skin stuff,
schizophrenia.
skin and
Yep.
gut are really connected,
And
just like brain and gut. Yeah,
yes.
absolutely.
Yes, and the celiac thing is so interesting you mentioned that because that was a big piece that was missed. And surprisingly, because I had the digestive symptoms, like going through the traditional workup, never once was I tested for celiac genetic potential. I figured that out myself later on when I was doing a cheek swab to see what kind of HLA gene types I carried for mold toxicity. And of all things, it came back, it's like, you're homozygous for the 2.5 lineage. And I was like, oh my God, like here this whole time. But it made perfect sense looking backwards. And so it's amazing how these things really get missed even when the signs are right there in your face, you know? So it is a big deal. And, you know, in my family, at least extended family, like there wasn't a lot of, you know, autoimmune diagnosis, but that's not to say, like you said, these potentials can't be there latent. And with enough, we could say, external factors starting to activate. I mean, I just feel like we're at a place in time where every generation has got a harder uphill battle health wise with all of the different environmental stress, lifestyle factors hitting them, right? Maybe you can
Yeah,
even talk about that, David.
so much harder to stay healthy nowadays than it used to be. I mean,
Yeah.
and like the menstrual hormonal things, 2 decades ago, I'd see a woman that like in her 80s, and her menstrual history was I had flows every 28 to 30 days, 3 days, nothing big. And then all of a sudden I knew I must have gone through menopause because I stopped having my cycles. One day I just like, hey, I didn't my cycle, and that was it. And you're like, I don't think any woman has that story nowadays, right? It's
No.
like, it's like, oh, that would be heaven to have any of that stuff.
I
It's
know,
how,
right?
and that's a good example, I think, of how hard it is to be healthy because, like you said, all these environmental toxins, the things in our food, it's
Yeah.
incredible, high levels of stress we have all the time. We're
Yeah.
talking about, toxic blue light from screens. We're talking,
Yeah.
all these different things just make it so hard to be healthy, including, early and recurrent use of antibiotics, medicines,
Mhm.
ages that have all these side effects, throwing birth control pills, that menstrual stuff. And it's
Mhm.
just, you just get going the wrong way. And then it's just this, just builds speed over time. So hard
Yeah.
that if you're not doing something really profound, doesn't have to be hard, but really profound in preventing medicine, you're moving to a chronic health issue, including people, go, hey, I'm exercising and trying to eat healthy. That is like nothing. That is
Yeah.
really truly almost like nothing.
Yeah.
Even though it's beneficial, there's
Right.
benefit, but it's just not powerful enough. There's other things that are so much more powerful and a lot easier,
Yeah.
because like more conventional medicine, you go, hey doc, I have this running my family, and I see a lot of people getting this stuff. How can I stay healthy? Oh, well, change how you eat and exercise.
Right.
And it sounds really vague, but really complicated at the same time. It's like, well, how do I eat and how do I exercise? That is like incredibly vague,
Right.
complicated versus, so what's your vitamin D level? Are the vitamin D receptors in your gut sensitive, or have they gone resistant?
Mhm.
These kind of big questions, you're like, well, man, you can get a huge bang for your effort by fixing that estrogen dominance in women, doing
Mhm.
some of these other things, doing the things that work through epigenetics. Well,
Mhm.
now we're talking, and it doesn't have to be hard, but it's like, well, now we're talking these really, really big central mechanisms,
Yeah.
because like there's like one way to eat for everybody. Well, just eat healthy. Well, we
Right.
wouldn't have 5 bazillion books about diet. Right.
Exactly.
And it's kind of like, well, everybody's different. What's right for me is not right for somebody else, kind of a thing. But when you're
Right.
talking about these really big central mechanisms, oftentimes that work through epigenetics, you're talking the stuff that is fixing everything at the same time. And you're getting this really huge bang for your effort. or the effort you're helping your children with. And as it turns out, you're helping the next 6 to 8 generations be healthier at the same time.
Yeah. So I'm really curious about kind of the process you use, generally speaking, kind of when you look at this with the patients you work with. I know that in my world, I'll use a combination of functional lab testing to kind of, especially with the gut, just to see, do we have some hidden stressors? Do we have some digestive weakness markers? Things we're seeing that just suggest that there's stressors there, right? And then, of course, obviously having a deep nutritional background, helping clients make not only smart changes in getting the food triggers out, but then improving the quality of their food. Because, we could
Yeah.
argue that, my gosh, you almost would have to eat like 12 cups of kale to get the same amount of like vitamin K2 you could get like 100 years ago as well. So, yeah, talk a little bit about your process, David.
Yeah, so we know what causes chronic disease. We know
Yeah.
what disrupts that immune system set point. And so that helps us a lot right away because we know where to look. And
Yeah.
so I like to say things like, well, let's test so we don't have to guess. Now,
Yes.
we can do some very educational guesses because we know where this stuff comes from,
Yeah.
but everybody's so different, it's like, oh, well, so many people are deficient in zinc, and zinc really helps tissue damage, heal, and all this kind of stuff. We'll give you zinc. Well, it's a blood test you can run because you may
Mhm.
not be deficient with zinc. Maybe it's something different, right? And you're kind of wasting somebody's time and effort and money by giving them zinc if they don't need it. So I like
Right.
to test and not guess. And so I
Yep.
think you might be thinking about, a digestive stool analysis. It's not
Mhm.
a test you can run in the hospitals, your doctor's office. It's a
Yep.
kit. You poop, you mail it off. Is really what they call like advanced testing, right? And
Right.
oh my gosh, the amount of information that is very, very, very helpful is
Yes.
incredible on something
Yeah.
that simple. And then
Yes.
blood work that I talk about. So like in my book, um, I talk about what blood test do you need to run. And
Mm.
it's not like something you have to do and mail off. Any lab anywhere in the country, and most of the ones around the world can run this stuff. Easy. Everybody can run it. If they're unfamiliar with it, they may run it wrong the first time, but they,
Mm.
they can run it, any one of them, and with the right diagnostic codes, it should be covered by any insurance company as well. And it really helps us pinpoint exactly what's going on.
Mhm.
Uh, the digestive stool analysis, the food sensitivity test, testing for delayed hypersensitivity reactions to foods. I find
Mhm.
those invaluable because you can really go, well, I think this is what's going on. And really, truly, with how much we know, it's almost like you use testing to sort of confirm your suspicions.
Yeah.
You really kind of know what's going on already because you know where this stuff comes from. So it
Right.
confirms your suspicion, but it's also like, oh, good, I'm glad we didn't waste your time doing that because that's not your issue, even though commonly it is. It's actually this. So we're going to do this. And the body is so good, you make these changes based on what you know. And truly, you should have enough change in the body that 3 months later, doesn't take years, 3 months later, you retest and you see some profound changes. It's like, oh my gosh, look at you body fixing all this stuff already. This is really great. Now it can
Yeah.
take a lot longer for that to feel really good. Because usually when we're talking about fixing chronic health issues, we're talking about decades, if not
Mhm.
generations of stuff. When somebody has their first symptom, like, geez, I woke up today, my knee hurts. That's weird. I don't think I did anything to hurt it. And it stays there for a couple of weeks. That actually started 20 years before. It takes about 20 years from the first disruption within a cell and how the cell function to actually get to the point where you go, geez, I got this thing. I wonder where it came from. So
Yeah.
it's not like you're dealing with something that happened last week when you woke up. This is something that's decades old, if not generationally old. And so it makes it even more amazing that the body can fix itself so profoundly and so quickly that people do start feeling better really fast, even if
Yeah.
they're a total mess by the time they start this process.
Oh, for sure. And that's so important what you just said. I mean, I think by the time we actually feel bad enough to reach out and start a process of working with whether it's you or anyone really qualified to help, like people don't realize how long that mechanism has been in play before they really got to that point. And so that's a really important conversation to have just to put that in perspective. And I agree 100%. I use a lot of functional stool testing and other types of tests at times too, just to really get that data. And You know, the interesting thing about the food sensitivity point you made is that I will kind of go 50-50. Often with clients, I'll use therapeutic elimination diets because I've gotten really good results with those. But I always have this subset of people, and you probably have them too, David, where they're very data driven and they're very black and white, and they just really want to know for sure that they're sensitive to wheat or they're sensitive to dairy or what have you, right? And so, and often it's not even so much the GI symptom people, like the people with IBS. It's other autoimmune conditions like, say, psoriasis and eczema are almost the hardest because those conditions can kind of be chronic and present on some level all the time. And it's not like you eat a food and you're going to immediately know that you're having a reaction. In fact, I just had a conversation this morning with someone in that camp, and I had to explain, like, you can't really know, though, unless you either take that food out completely for at least 90 days, or we do a test and we check to see if there's immune reactivity to this, right?
Yeah, yeah. The delayed hypersensitivity reactions, the IgG reactions, in a lot of the medical community, it's still like, that's not a thing. Well, it is, and you just haven't read or chosen not to go even take 2 minutes to Google search on PubMed or something like that, because even like what 12, 15 years ago, irritable bowel syndrome, notoriously hard for Western allopathic medicine to deal with.
Yeah.
And studies that come out that, well, if you do a food sensitivity test and you eat clean based on that food sensitivity test, you're 40% better on average in 4 weeks, you're 80% better on average in 8 weeks.
Mm-hmm.
You're like, well, that wasn't hard to fix at all. It turns out, Western medicine goes, oh, I don't know what to do. It's like, it actually is not that hard, right? And you know what to do. And so, I kind of explain it like, here's foods can bug you right away, immediate hypersensitive reaction, they sneaky delay, days or weeks or even longer afterwards. Geez, I wonder where all this inflammation is coming from. Well, here's a food that's bugging you sneaky, whacks you like 4 weeks after you eat it. Inflammation builds until you go, geez, where's all this inflammation coming from? I should really be feeling a lot better than I am. I know this inflammation has to be coming from someplace. I've done my reading. I know it doesn't come from nowhere. But one thing I know for sure is not causing it is what I eat, because nothing bugs me when I eat it. And I go, it doesn't bug you the obvious way, it bugs you the sneaky way. And they go,
Exactly.
oh, and kind of a light bulb moment. I go, yeah, but we get rid of those foods temporarily, you open up the window of opportunity to fix everything, including you can eventually fix those food sensitivities.
Yeah, absolutely. Absolutely. And sometimes I'll have like a particularly kind of like obstinate client that'll be like, well, I know for sure this isn't a problem. And I'm like, well, how do you? Because you're sitting here right now with me. And like what you're doing hasn't been working. So clearly we've got to try something new here to try to get a different result. And we could test, but I'm trying to be like a good steward of your testing budget here too, right? So it's really funny. And sometimes if you flip it a little bit, people will be like, oh, that is, maybe there is something there. Maybe I should think about that. So,
And you're right, when you're kind of giving people the option of the testing versus the elimination diet,
yeah,
there are some people that go, I don't want to put any effort into avoiding a food unless I know for sure it's bugging me. So let's
it's
do the test
true.
because I don't want to waste my time. Like,
Yeah,
sounds
absolutely.
reasonable. Uh, you
Uh,
know, thing.
Yeah. No, for sure, for sure. And I mean, I will go there. I love to go there. No problem at all. But yeah, it is really interesting. And that's where I think trying to kind of work with each client or patient's unique wiring and what they're really hoping to get in terms of their learning process too, as they're going through that health journey is really, really key. So I want to ask you kind of an interesting question around the whole epigenetics as well, David. And this is a bit of like a deep wormhole to go down, but I wonder what your thoughts are on the whole terrain versus germ theory. Because I know in my functional training, looking for those hidden stressors, whether they're pathogenic bad gut bugs. I try to use simple terms, right? Gut bugs, not so much bacteria, dysbiosis, try to avoid those terms, but stuff that's going on in the gut or toxins maybe that a person's been exposed to and they've got a load that's now built up and they're just not detoxifying versus kind of the stressors we were talking about earlier in the conversation where if they're already sort of from a young age foundationally in a weakened state because of, say, family culture stressors or attachment issues they had with a parent or whatnot. How do you kind of strike that balance and look at that whole kind of picture?
Well, the gut's really smart and the gut is so resilient. And we talked about how, something happened and 20 years later you get your first symptom. Well, that
Yeah.
your body's been fighting the fight for 20 years. It's trying to reverse it. It's trying to get this taken care of and it's fighting the fight. Well, eventually it's just totally overwhelmed and it's like, oh, it got the best of me. Oh, I got knee pain, or all of a sudden I got headaches, or whatever it is. Um, uh, it is, kind of the terrain where it just is a combination of all these things that build up over time.
Yeah.
And eventually, it's very challenging to be a human being. There's
Yeah.
all these things that are happening to try to throw us off. Oh, I got a car accident. Somebody I love passed away. I have this terrible stress at work, all this. Well, it's kind of like all the terrain stuff that you're talking about kind of loads the gun,
Hmm.
and something is going to pull the trigger someday, you
Yeah.
know. Uh, but if the gun's not loaded, you can pull the trigger all you want. All these things happen. Geez, I'm driving down the highway, terrible rollover car accident. You go, nobody's going to live through that. They get out of the car, climb out because their car's upside down. I'm okay. I'm fine. You go, oh my gosh, how are you even alive? Right.
Yeah.
Well, the trigger was pulled, but the gun wasn't loaded and they walked away. And then
Yeah.
somebody else stopped at a stop sign. The person behind them just spaces for a second, takes their foot off the brake. They just ding the back of their car. Everybody
Yeah.
gets out. No damage. They don't even exchange information. But the person goes, oh my gosh, I've had neck pain for 10 years since that. Well, their gun was loaded and that was enough to pull the trigger.
Yeah.
And this is where it's kind of like, well, it's you know not so much what happens, it's kind of the state of the person who it happens to. And the
Right.
most minor thing can kick all this in if that terrain is just a mess, or if the terrain looks good, things happen that you wouldn't wish on your worst enemy, but it didn't get in and mess you up. I kind of think about the terrain is kind of like a backyard swimming pool. Well, the backyard
Mm.
swimming pool, crystal clear water, shimmering in the sunlight. Oh my gosh, so inviting. That's kind of your terrain. Or the
Yeah.
backyard swimming pool, covered with algae. Somebody threw old bald tires in there. There's a squirrel that drowned and is dead floating around in the beer bottles, and all this is like, fuck. It's the same backyard swimming pool, but it is an absolute mess. Well, that's
Yeah.
kind of the terrain where it can be crystal clear, it can be a total mess, but that's what we work on with the stress management and nutrition stuff, and keeping away the infections that drive chronic disease and keeping your immune system healthy. All these really keeps that backyard swimming pool crystal clear and so inviting. You can be pulling the trigger all you want, the gun's not going to go off and give us these health issues. But it is a challenge because it's hard to stay healthy in this day and age. Oh, so hard.
Do you find yourself getting up super early on work days in order to get done with multiple runs to the bathroom? Or waiting and waiting to finally have a bowel movement? Has living your life around unpredictable bowel movements and other chronic gut symptoms left you feeling trapped, stressed, and dealing with anxiety? There are often hidden factors and stressors driving these symptoms, factors that your doctor isn't trained to help you find. Getting to the bottom of these factors, along with the right nutritional approach, is the key to resolving your symptoms. Interested in learning more? Click the link to grab my free e-guide. Yeah. Oh no, for sure. And I love those analogies. And maybe just to kind of touch on that, what do you think are sort of the above and beyond types of factors that the average person has to consider or look at that go beyond just kind of like eating healthy, even though that's very general, right? And exercising daily, right? What are some additional things you think people might not be aware of that do play a role in kind of keeping chronic illness at bay?
Well, the things that get missed, I think, are that every chronic health issue, that there's a bad bug in there, in the gut,
Yes.
the bloodstream. There's always an infectious one. Now they're the ones that we test for on blood tests, check on the digestive stool analysis, but there's always an infectious component. You got to get rid of these infections. And the other thing is we hear a lot about vitamin D, uber important. Uh,
Hmm.
there's tens of thousands of studies, scientific studies, and scientific journals about how important vitamin D is. But I think one big one that gets missed, that I talk a lot about, especially since 2015, when the data started coming out, is one reason why vitamin D is so important is every cell in our body has a receptor for vitamin D.
Oh, yeah.
He has to go to every cell, attach to the receptor for vitamin D, and tell the cell what to do.
Hmm.
It's not for everything, but there's more vitamin D receptors in the gut than any other body part. And when the researchers back around 2015 saw that, they go, wow, vitamin D must be really important for the gut. Well, it turns out, though, that vitamin D receptors can become resistant to vitamin D.
Mm.
You can have all the vitamin D in the world, and you should have like a blood level between 70 and 90.
Mm-hmm.
Got Parkinson's more than 100, cardiovascular more than 95. But you can have all the vitamin D in the world. It won't be able to attach, especially in the gut, to receptors because they become resistant to vitamin D. Just like you get insulin resistance, where you can have all the insulin in the world, but if the receptors for insulin in your body parts, your cells are resistant, you can't attach and do the work. It's almost like you don't have insulin, blood sugar goes up.
Yeah.
I think vitamin D. Well, the original data, I'm going to give a little shout out because I went to University of Illinois Med School. So this is University of Illinois Chicago campus, a different campus than I went to, but Chicago campus researchers, they figured out this and they go, oh my gosh, fixing the vitamin D receptor resistance is exactly what you want to do if you're going to try to turn around the notoriously hard to turn around autoimmune diseases of the gut like ulcerative colitis and Crohn's disease.
Mm.
But also, if you want to get rid of recurrent H. pylori and recurrent C. diff infections, that can be
Mm.
notoriously hard to get rid of. But it looks like to us, if you fix this vitamin D receptor resistant thing, make them sensitive again, it looks like what you want to do to fix everything. And they talked about the three things you got to do. I call them the foundational triad: daily vitamin D, daily probiotic, and daily butyrate. Now,
Mm.
I think most people are familiar with vitamin D and probiotics, but they may not be familiar with butyrate. Well, butyrate is what they call a short chain fatty acid made by
Mm.
the good bacteria in the gut. We're going to talk hopefully more about that because it almost exclusively works through epigenetics. Okay, so your good bacteria making it, but that foundational triad fixes the vitamin D receptor resistance. This is what you want to do that. Well, then the same researchers 6 months later published an article. They used the term nuclear weapon. Fixing the vitamin D receptor resistance is a quote unquote nuclear weapon against metabolic syndrome,
Mm.
weight gain. We have an epidemic of obesity, diabetes, blood sugar control issues. We have an epidemic of that, but also cholesterol issues and those kind of things, right? And wow, that is a nuclear weapon. Well, then here's the Harvard Journal of Psychiatry that comes out a couple of years later that goes, well, if you can fix the intestinal microbiome this way, and I go, that's what happens when you fix the vitamin D receptor resistance. You can treat major depressive disorder with it. And then another psych journal comes out, well, if you can fix the gut this way, and I go, that's that vitamin D receptor resistance thing. It changes personality traits. People become more outgoing and more social. And then,
Oh,
at
that's
that
crazy.
point, it's kind of like, well, this is the uber central mechanism, but people don't know that. Now,
Interesting.
but to your point in the podcast, part of
Yeah.
that is using something that works almost exclusively through epigenetics as a supplement, comes in capsule form, no big deal. That allows you to fix the gut in the way it allows you to fix everything. And then ultimately, your good bacteria, you have more of the butyrate producing good bacteria, and they can make more of it. And now you make it on your own. Now the gut's healed in a way that fixes everything, but now you locked in this really big central mechanism that you want to lock in to stay healthy your whole life, including your body part. The good bacteria in this case is actually making something that works exclusively through epigenetics so much better on its own to help you fix everything at the same time and stay healthy, and then ultimately pass on better gene expression to the next 6 to 8 generations.
Yeah, that's really fascinating. I had not heard that butyrate was linked to turning on good genes or even just had that epigenetic mechanism to it. A
Mhm.
question that kind of comes up about the whole vitamin D receptor resistance, would that correlate with vitamin D levels in the blood, or could it be that somebody could have sufficiency in their D, especially if they're supplementing, but still be resistant at the gut level?
Yep. Have perfect vitamin D levels, getting almost no bang for their effort because of that vitamin D receptor resistance in the gut. Yep.
Interesting. Is there a way to actually measure for that, David, or is that just something you have to kind of indirectly surmise?
Well, they're indirectly, because what
Okay.
tends to happen when the vitamin D receptors become resistant, you're low in the good bacteria on a digestive stool analysis. You have too much of the bad dudes.
Uh-huh.
You have too much inflammation, like the inflammation markers like lactoferrin and calprotectin and
Sure.
stuff like, um, because when the vitamin D receptors become resistant, the lining of the gut actually starts creating its own inflammation, the pro-inflammatory cytokine production by the lining of the gut itself, like NF-kappa beta production goes way up. And
Yeah.
this is where you hear things like the engine can become this engine of inflammation, where it's so
Sure.
disrupted, it actually starts creating its own inflammation. And
Yeah.
then, the gut stops making a special protein called antimicrobial peptides, AMPs.
Mhm.
Antimicrobial peptides are proteins the lining of the gut are making to keep bad bugs out of the gut.
Yeah. Yeah.
And so digestive stool analysis, low in the good, too much of the bad, tons of inflammation. You go, I think I'm dealing with vitamin D receptor resistance. You fix that, all the good guys go up, bad guys come down, all the inflammation goes away. And now, because lining of the gut's making antimicrobial peptides better, the bad dudes don't come back, kind of a thing. And
Yeah.
this is where you can sometimes look at the digestive stool analysis and go, well, we're fixing all this stuff, but man, that inflammation is still staying really high.
Yeah.
Or it's actually getting worse over time. That's weird because I'm doing what I should do to fix the gut, but I'm having a really hard time getting the intestinal microbiome the right way, including not able to build the numbers of butyrate producing good bacteria, and butyrate levels are really hard to bring up. Even if you're taking butyrate as a supplement, the levels are still much lower than you want, because ideally
Mhm.
the butyrate levels tested on digestive stool analysis is not what you're taking as a supplement, it's what you're making on your own, kind
Mhm.
of a thing. And so that's where, if you go, geez, this is a little harder than I would have anticipated on the repeat testing, you go, yeah, that's that vitamin D receptor resistance deal.
Yeah, that's so fascinating. And I know, just looking at a lot of the stool test that I like to run is the GI map, and
Yeah,
it will look at kind of, do you run that one too, David?
I like that one. Yeah.
Yeah, it'll look at, like, this as well. They've got Akkermansia, which is a keystone kind of mucin degrading strain. And I've just seen time and time again this pattern of more inflamed gut environments. It's straight up missing, right? And it can be
And,
hard to bring
and,
back.
and the Akkermansia muciniphila species is a
Yeah.
big teller, because one of the things that says the vitamin D receptors have become sensitive again is Akkermansia muciniphila goes way up. It's such an
Yeah, I
important
wondered.
guy. So if you
Yeah.
see Akkermansia species low, you're probably dealing with the vitamin D receptor resistance.
Oh,
You
that's so
good
interesting.
place, you probably fixed it.
Yeah, and the other thing, and I don't know if this is something that relates or not, but just again, what I've seen looking at lots of testing, I have clients every now and again that will want to get like fatty acid status checked as well. And what kind of blows my mind is that I don't work with a lot of these people, but I've worked with enough of them that I know their diet is really solid. They're avoiding the rancid seed oils that are high in omega 6s, right? And they'll inevitably have an omega 6 predominance, and specifically like arachidonic acid will be high. And I always sort of suspect, because a lot of times this person's dealing with an autoimmune condition, I sort of suspect that it's less dietary input and more just the inflammatory environment of the body that's favoring
Yeah.
that balance. I mean, I can't prove that, but I don't know if there's something that you can say to that whole piece of it too, if that relates.
Yeah, that's a really good point. And this is where you hear, oh, the gut can become this engine of inflammation, but I tend
Yeah,
to find other body parts can do the same thing. So like
yeah,
type 1 diabetes, where the
yeah,
pancreas stops making insulin, epidemic, 20,000 young people under the age of 18 every year are diagnosed with type 1 diabetes.
yeah,
325,000 people now, or children have it. And it used to be called childhood onset diabetes.
yeah,
But then adults started getting it.
yeah.
And when adults start getting childhood onset diabetes, you would have thought the powers of B go, wait a minute, adults are getting childhood onset diabetes. Something weird's going on. We got to figure it out. Well, no, that's not how it works. They say, well, we just got to change the name. We can't call it that. We better change it to type 1 diabetes. And I was like, oh, you guys, you missed the point totally, right? But then the insulin resistance diabetes, oh, that's adult onset diabetes. Well, now kids get it. Well, we can't call it adult onset anymore. We'll call it type 2. I go, oh, you guys missed the point again. Like, what the heck's going on, right? And so um, uh, almost every kid we see with an autoimmune disease, and we see tons, juvenile rheumatoid arthritis, uveitis, 70% of all autism is one particular autoimmune disease. Almost universally, every kid we see with an autoimmune disease is actually moving to type 1 diabetes. The pancreas is not making insulin well, or not at all by the time we see them.
Yeah.
And unfortunately, you can basically make no insulin as a kid and still have 1 to 3 years before the big crisis happens, that diabetic ketoacidosis, life-threatening event. In
Yeah.
adults, 3 to 7 years. But we see kids not making insulin well or not making it at all, but we have time to turn around. Um, the liver is supposed to make something called TUDCA, which
Yes.
is called
Yes.
a bile acid, but it's also called the chaperone molecule. So
Yeah.
hopefully we get a chance to talk about it because it works through epigenetics as well. It's one of the three really cool things it does.
Yeah.
Cool, it even works in other ways besides epigenetics. But without the liver making enough TUDCA, the pancreas can't make insulin. This is
Mm.
why children that have jaundice around the time they're born, the liver got dinged. The liver is not fully formed until about 8 months of age.
Yeah.
Kind of a dicey 8 months because it's kind of a little friable, easily disrupted. Jaundice, liver got dinged. That child has a 25% increased risk of type 1 diabetes.
Yeah. Yeah.
Preterm infants, 3 to 4 weeks before term or more before term, their liver doesn't make as much TUDCA as term babies. They have a profound increase in type 1 diabetes. But because it's such a bad place to be where your liver can't make this TUDCA, they're more likely to get type 2 diabetes and all these other diseases decades later because of epigenetics and all this. And
Yeah.
so you use TUDCA as a supplement, comes in capsule, to get the pancreas to make insulin better. But bad bugs in the gut, enteroviruses like Coxsackie virus, which is one we test on everybody, Coxsackie B4, there's 6 different ones we test, B4 will translocate from the gut to the bloodstream through the leaky gut, go to
Hmm.
the pancreatic cells, beta islet cells to make insulin, and start creating inflammation and damaging the tissue.
Okay.
Well, then you really don't want to get the immune system's attention. You don't
Yeah.
want this information and get the immune system and go, hey, something's going on over there. I'm going to investigate. You go, oh, no, 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 no. So, here are these macrophages that migrate over to the pancreatic beta islet cells to see what's
Yeah.
going on here because TUDCA's not there. There's a bad bug there. And then instead of being an M2, gets rid of inflammation, it changes to an M1 that creates inflammation. Oh, so the pancreatic beta islet cells become their own engine of inflammation.
Oh God.
And then here's type 1 diabetes, right? And
Yeah.
kids or adults. So this is where that body part can become an engine of inflammation. But also you can kind of see this in other body parts. It becomes its own engine of inflammation. So
Yeah.
you undo it with kind of the classic things like, well, you got to fix the leaky gut,
Yeah.
right? You can't have bad bugs, including Coxsackie B3 translocates from the gut through the leaky gut to the bloodstream, goes to the breast tissue and drives breast cancer. It's a huge driver of breast cancer. There's
Mm.
a couple of studies I did videos of that we haven't released yet, where they talk about, well, preventing breast cancer. It was so sad. And I decided to do these videos because all of October was his breast cancer awareness month.
Yeah.
All you ever heard anybody talk about, including docs on TV, the key to breast cancer is early detection, early detection.
Yeah.
And I'm like, you're telling me you're not going to do anything to prevent breast cancer? Nothing at all. Not we're not even going to do anything to prevent breast cancer. We're just going to wait till you get it and detect it early. That's the key to breast cancer. And I'm like, oh my gosh, that is terrible state of affairs. Because I'm like, hey, the study science out there says we could prevent 90 to 95% of all breast cancer. And
Yeah.
for people that fall through the cracks, early detection is great.
Yeah.
But I did this whole series of videos on these articles where they talk about Coxsackie B3 translocates the enteroviruses, including Coxsackie viruses, translocate past leaky gut and the bloodstream, go to the breast tissue, and it's the Coxsackie B3 that then drives breast cancer.
Hmm.
Well, then they said, well, how do you fix this? They said, well, when you use these three things together, it's really neat. When you use vitamin D, probiotics, and this thing called butyrate, you can actually fix the gut in a way to prevent breast cancer. I'm like, all right, all right. All this dovetailing, like everything's connected. And I'm like, that's so cool. The breast cancer research is just like the researchers at University of Illinois, Chicago, who say, well, this is the way that you fix the gut so you can prevent autoimmune disease of the gut and all this. But it's also a nuclear weapon against diabetes. Harvard says you can treat major depression. depression. The other one goes, hey, you become more outgoing and more social. So these are the kind of these really big central mechanisms that we can address, that addresses everything at the same time. And I
Yeah.
find it so fascinating. I think that's how inherently smart the body is because the body's like, well, this is what I need. And if you do that for me, I can do everything else myself, basically,
Yeah.
including um, preventing and reversing type 1 diabetes.
I
Like
believe it.
the infections, fix the leaky gut, get rid of that inflammation, kill the bad bug is in there with the right broad spectrum antimicrobial, use TUDCA. We can actually wake up those beta islet cells, including inherently the body is so smart. After somebody is diagnosed with type 1 diabetes, there's what they call, and it goes by different names, like a holiday period. And
Mhm.
in young kids, it's not as long for girls as guys.
Yeah.
Man, girls' health is a lot more complicated than the guys' health. That's why 95% of my patients are women, because I think this is the greatest thing ever, because I really want to help women. I've had such great women in my life. I want to make sure every woman feels great, including
Yeah.
women who are still kids,
Yeah.
where they have this holiday period where the body can totally reverse the type 1 diabetes for a period of time, or a profound lessening of the insulin required to control blood sugar during that holiday period. Wow, the body's trying to do it itself, and it actually sometimes does it, but we
Yeah.
have this great opportunity, and we're talking like, 8, 9, 15 months, pretty long period
Yeah.
where the body's really fighting it. You don't need as much insulin. Sometimes you don't need insulin at all, but unfortunately, we don't do anything during that period. We're like, well, we know we're not going to do anything to help, but we're just watching and observing. This is really cool. And I'm like, oh my gosh, we have this huge opportunity where the body's like doing most of it all by itself, that we could actually jump in and totally reverse it. But when it comes to like this type 1 diabetes, the body's so smart. Usually, um, those pancreatic beta islet cells that make insulin, they're actually still there, but they're dormant.
Okay.
They're not destroyed, they're actually dormant. And you can have type 1 diabetes on insulin pump for 10, 20 years. You still got all the cells that make insulin, they're just sleeping. TUDCA not only helps you make new healthy cells that make insulin if you need it, but they wake up the dormant cells. And so
Okay.
for most people, it's not even like, geez, we got to make new cells that make insulin. We just got to wake up the ones that are sleeping. Oh, this is a
Yeah.
lot easier, kind of a thing. And so, the body's ability, including this TUDCA made by the liver that works through epigenetics, is one of the three things it does. The body is so smart. We can use these things that either, totally work through epigenetics or at least partially work through epigenetics to really turn around this kind of stuff that, in most people's minds is not turnaroundable, but truly body's so smart, just about anything's turnaroundable.
Oh, for sure. No, and I think this is such a fascinating topic, just thinking about these different nutrients as almost like signaling molecules, right? Like it's kind of like shaping the environment to facilitate that healing mechanism, bring that balance back between the pro-inflammatory state and, the immune system being able to kind of like maintain tolerance for self,
Yeah.
which just would make so much sense because kind of back to your original point, really all chronic disease, even cancer, even type 2 diabetes is just some sort of immune dysregulation one way or the other. And I mean, we didn't even really touch on this, but I think a lot of people have both the over and the under activation kind of going on at the same time too, right?
And this is where, just throwing the immunosuppressants at somebody is so sad, where, uh,
Yeah,
the only option they're given is medicines that suppress the immune system. And my experience is whatever the type of doc that provides you the immunosuppressants never say, oh, by the way, this could increase your cancer risk, your
I
risk of
know.
threatening infections.
Yeah.
Um, and that's the only option they're given. Where
Yeah.
what you really want is not to suppress the immune system, is you want to, rebalance it, then immunomodulation, bring them back to the middle. And then you've done your due diligence, not only on what they already have, but knowing how connected on the immune system dysregulation is for everything. You've really done your due diligence to help, prevent them from, getting stuff the rest of their life.
Yeah, no, 100%. I'm totally with you. And I think that's the biggest drawback is just what are the long-term consequences of staying on those drugs, especially cancer risk. Like that would be a big, big one for a lot of people, I think, right?
And you see them use those meds even in people that have already had cancer or have a strong
Yeah.
family history of cancer. And
Yeah.
I'm like, oh my gosh, that is it's just terrible, terrible. I mean, it's kind of like I always say, well, you got to do what you got to do to get through your day. So if
For
you are
sure.
so much in a bad place by the time you get diagnosed with your autoimmune thing, you got to do what you got to do, and if you got to get on immunosuppressant to get through your day, you got to do that. But then
Right.
ideally, what you should do is just buy you time, a little bit like you mentioned the birth control pills for those bad, menstrual hormonal things. You got to do what you got to do through your day, right? You can
Yeah.
take it, and if you got such terrible cramps that you can't get through your day, or menstrual flows are so terrible, you're sitting in high school and you wear white jeans and now you're sitting in a pool of blood. Go
Yeah.
to the school nurse and they give you a pair of white sweatpants to wear instead, and you go back to class, you're like, oh, it's like you gotta do what you gotta do. But it should just buy you time to go back and go, well, what's really going on? Let's fix this. I don't need any of this crap. Um,
Ah,
Another thing. And so if somebody comes in on me as presence, I'm like, totally cool.
yeah.
2, 3, and I see that, right? Totally cool. Let's go back though and figure this all out for you. And then get you off that medicine so you don't have all these downsides. And pretty much anybody who's been on those meds for more than 15, 20 years, my adult population, they get cancer.
Yeah, I
It
could see
doesn't
that.
happen right away, but it's pretty much
Yeah.
they got cancer from
Yeah.
that.
Which, if anything, just I think people hearing you say that is going to be a stark warning a little bit, right? And sometimes we need to kind of really think about those consequences because we do live in a very, let's just get the short-term gain right now, and we don't care about the long-term trade-off type of culture. And really, I think this is where more and more people do have to become very informed about what's going on. They have to ask questions about these decisions and the side effects of these drugs and what they can expect. And, good news is I think people that reach out and are interested in working with people like us, David, they're already sort of dubious of these things. And deep down, they want to get to the root. They know that the drug isn't going to really be the solution, right?
Yeah, and then that's such a fortunate thing that the word's getting out. The parents who have children with these things,
Yeah.
so many of them are really wanting to avoid the use of those ones, and are going to do whatever they can to do it, or they had to get their child on it because a child couldn't even walk or crawl or anything,
Mm,
and then they go like, okay, so we got them through the day. My child's not dying right in front of me. Now I'm going to go back and find somebody who can help me reverse this kind of stuff. And then the adults as well. I think it's a shame that when somebody's put on those kind of medicines, they aren't told the side effects right away, because ideally that's what's supposed to happen. This is what we recommend. Now I want
mhm.
you to know what the potential side effects are.
Yeah.
And then also, if you watch TV at all, you're seeing probably 20 of these commercials every
Oh,
hour on
gosh.
TV because of
Yeah.
the epidemic of these different autoimmune diseases.
Yeah.
And you see any medicine that they go, oh, this will give possible side effects or increased risk of cancer, including lymphoma and life-threatening infections. You go, oh, that must be an immunosuppressant, right? And right
Yeah.
that there you should go. Well, they just said 30 different side effects on that commercial. But I heard those too, and I know what kind of medicine this is apparently, and that's not something that I really need, but it really tells you how prevalent this stuff is because every commercial is all about this stuff nowadays. It's crazy.
Oh, for sure, for sure. Well, I could continue to talk to you all day. This has been such a fun and fascinating conversation. I know I learned a lot about just the epigenetic signaling of TUDCA and butyrate, and I had no idea. So I really appreciate that bit, and I think that is going to be really interesting for the people who have been doing a lot of their own research and trying to get to the bottom of this stuff. So I appreciate that, David. What is the best way for the audience to find you?
So my website is drdavidbilstrom.com,
Yeah,
and we have educational courses for non-medical people, for medical people, because I really feel like there needs to be somebody in every community who knows how to do this stuff. Uh,
yeah.
we also have blog posts and wellness Wednesdays, and I do tons of videos about this stuff. And just about every video I do, I have over 150 on my YouTube channel, is here's this scientific article,
Oh,
because I
cool.
really think it's important, including in my book that's for medical people, but also for non-medical people, there's 100 different scientific references. In my textbook chapter that I was asked to write about managing pain in the presence of autoimmune disease, it's 150. I really think it's important that people know that this is the science. This is not one person's opinion. This is not a group of people opinion. This is the science. And
Yeah.
it's just a science that the people you've probably seen that might even have diagnosed you just don't know. They may
Right.
know how to use these medicines. Don't ask me to use those medicines. I have no clue what doses and how often affect your liver function and all this kind of stuff. They know the meds, but they don't know this stuff. But that's
Right.
okay. Nobody can know everything, right? So, but it's
Right.
important that everybody know that this is the science
Yeah.
behind this stuff, and science is guiding the stuff we're talking about here, and
Yeah.
how we're going to get you turned around
Yeah. There's just
in the
such a
next 8
need.
generations.
Oh, for sure. And there's such a need for that. And I so appreciate that you're doing that because it is, I love research too, but it is a time consuming endeavor to go dig that out but it very well worth it. Right. And people need to be doing that and putting that out there for consumers. So that's awesome. So I am going to link all of your contact information in the show notes. And I think you even have like a free 7-day email course that you offer as well. So I'll be sure to link that too, David. Thank you so much. It's been such a pleasure having you on today.
Oh, my pleasure, Courtney. Thank you so much for having me.
Absolutely. Did you find this episode informative and helpful? I'd love to have you leave me a 5-star rating. Do you have questions about holistic approaches to optimizing gut health that you'd like to ask? Please leave your question or comment below, and I will be sure to address it personally or cover it in a future episode. Be sure to check the show notes for any resources mentioned in today's episode. See you next time.